Welcome. I'm Julie Thompson, Executive Director of PACTV, and today we're hosting a COVID-19 update for the town of Pembroke. We're hosting these forums every Tuesday and Thursday for now at 9 a.m. Watch in Pembroke on Comcast Channel 15 or online on our streaming channel by visiting pactv.org/live. To ask questions during the forum, please email them to pembrokeinfo@pactv.org. For the forum replay schedule and additional Pembroke meeting coverage, please visit pactv.org/Pembroke. Sabrina Chilcott, Pembroke's Assistant Town Manager, will moderate the forum and will introduce the participants that are contributing again today. Welcome, Sabrina.
Thank you very much, Julie. When everybody was here, when we were gathered last week on Thursday, there was a lot of conversation about what could happen, what might happen, and how we were doing in a stay-at-home advisory with our non-essential businesses closed. And then we had a long weekend, or a regular length weekend, not to confuse that issue, but we came out Monday and we learned more from the governor's task force and from the governor. And that was quite a lot of information to digest. So just to get started this morning, I wanted to ask Health Agent Lisa Cullity, who's joining us today, and forgive me, we're also being joined today by the Council on Aging Director, Gretchen Emmetts, the Operations Lieutenant at the Pembroke Police Department, Richard MacDonald, and Acting Fire Chief Ken McCormick. And I want to thank everybody for coming in today. I know that the template, the entire ramp up has changed, but back to the point, there was a lot of information given out on Monday. Lisa, can you help us digest everything that we heard?
I can try. So as anticipated and as many days promised by the governor, he did unveil his phased reopening plan that identified some specific businesses that may open on specific dates. There was also guidance included within that that all businesses needed to comply with for public health and safety. So within that template, he did identify manufacturing, construction, and some limited office type activities that can come back online the next day. He also identified some following businesses that could reopen May 25th. And he also identified a template, then the one that I'll probably refer to several times today, a template for all businesses. Certainly certain businesses that have some industry specific safety standards are going to have some slightly enhanced guidelines they need to meet. But as a quick overview, because the governor spent several hours on this, there are basically 6 key components that all businesses need to comply with in order to be compliant with the reopening criteria as outlined by the governor, and that compliance is expected by open and operating businesses currently by May 25th, and it is required of all businesses before they open if their opening dates are subsequent to May 25th.
Well, Lisa, that's good, and obviously that's a lot to consider and actually go through and analyze and figure out exactly what business meets what metric, what date, what everything else. But in the overall view, did he give any specifics on the phase 2s, the phase 3s, and what does phase 4 look like?
So the easiest way to confirm all of that is phase 1, 2, 3, and 4 are outlined on the state website, which mass.gov/COVID reopening plan. Also conveniently done by yourself. All of those broken down criteria are hyperlinked from our own Town of Pembroke website. So again, phase 1 was more the light industry, the constructions. There's some limited office type criteria that was in there. Phase 2 is going to focus on some curbside retail and some other things like that. Phase 3 appears to be focusing on our restaurant and some sort of a capacity of retail operation. And phase 4 is where we're going to see things like gyms and whatnot. And I'm sorry, stepping back to phase 1, we are going to see hair salons, not other type of personal services, but hair salons and barber did come back on and are coming online for the May 25th deadline with a lot of criteria as well. And what's interesting about that particular faction of business is there is a breakout page specific to salons to provide them more information on that mass.gov COVID reopening page, some specific to them. But the 6 criteria of basic reopening applies to them as well.
Now, from what you're saying and from what I gleaned from Monday, I'm getting the impression that while some things will reopen, it doesn't mean that they will be walk-in and they will not be just open doors. Places
Correct.
will still remain locked and there will be
Correct.
appointments and
Yep.
limited engagements. Is that correct? And how does that work?
Correct. And that's going to be specific by the business of how they want to handle their clientele. But people need to understand from the outset the idea of walking up to businesses as we did prior to this is just not a possibility. You're not going to walk up to and walk into a business as you might have before. For example, salon protocol specifically calls out there shall be no waiting room, there shall be no walk-in, clients shall be by appointment only, capacities shall be 25% capacity or less. The rule of no more than 10 persons gathering still applies. Now that's going to affect each business differently depending on how many different workspaces, workstations, or rooms they might have. But all of those restrictions are still in place, which certainly creates a challenge. And that's why the public should not anticipate walking into any business to do face-to-face business. I strongly urge any member of the public needing to do business with any capacity, including the government, to call ahead and make arrangements to do so.
And you really drilled in on a good point. I mean, the occupancy points didn't change, and there were no assembly changes. We still are operating under a low set of numbers for safety reasons.
Yep.
And each business now, as they plan their reopening strategy, they're not required to open on these days. Is that correct? As they go through their plans and actually execute a safe maneuver, there's no obligation to actually hit these dates as they come. They have to do it in their own time. Now, can you explain, again, I'm not sure that I'm right on that, if you'd cover that, but also as a business owner, what are the things that I'm thinking about in order to open my business?
So the things I'll play let's pretend or let's look into the future, and I'll pull out my crystal ball. So if I was a business owner, things I would be thinking about is what can I do to keep my, most importantly, my staff, but also my clients as safe as possible? So I'm going to be thinking about, is my business optimally arranged for social distancing? And if it isn't, can I change that? What can I do? For example, I own a hair salon, and maybe I'm going to pick a worst case scenario. My hair salon is smaller. My workstations are all in a single room. I have no breakout rooms or adjacent areas. And I have 10 stations in one room. Well, as I measure my stations, they're really all only 3 or 4 feet apart. They are kind of close together. And that's pretty typical of some of your smaller salons. So now I'm the business owner of this business. What might I do? I might consider only using every other station. Now, of course, that's a problem. Maybe I have several hairdressers, and how do I accommodate what I know is going to be a lengthy list of clients looking to get in, but I can only have 5 people working at a time when I used to have 10 people working at a time. And here's some of the creative solutions I've heard from different individuals. One of them said, okay, we can only do 5 stations, but we know we have 500 people dying to get in our door. So what they're doing is they're having, a set of stylists, depending on their work schedules, work a morning shift. But they're also opening earlier certainly than they did before. And then they're having a second shift of stylists work the afternoon / into the evening. And they're also staying open later than they would traditionally stay open. This allows them to process a higher number of people through the course of a 24-hour cycle, but not have all those people in the room at the same time, which I thought was a really smart plan. So in other words, yeah, someone might get a 7 a.m. hair appointment, but I know there's a lot of people right now that would take a 5 a.m. hair appointment as long as they could get one. So, they're going to have to be creative with both their staff and their clientele, but that's one creative solution to being able to serve a larger number of clients in a smaller space, but do so safely.
Now, there's one thing I haven't heard yet, and I don't want to put you on the spot. But there's a lot of people interested in not only child services, but senior services. So you've got these 2 populations that you're really trying to be careful with in terms of setting parameters and static goals, because that's not always going to be feasible. What has been an early indicator of their phase cycle, and what kinds of things would you anticipate the town would need to react to, and that each individual business owner would need to react to?
Obviously, that's going to be a challenge. Obviously, there's going to be some parents with young children at home that do not currently have childcare, and returning to work is going to be a challenge. And my hope would be that the employers and the employees would work together to resolve that. For example, the hair salons, I know that she alluded to the fact that some kids have child coverage in the morning, and some have it in the afternoon, and some don't have it at all. So she's going to try to work at so that if a mom needs to stay home with her children in the morning, she comes in with the later afternoon or an evening shift, or vice versa. If she has someone at home during the day but not at night, she's going to have those staff come in the early morning to midday kind of stretches. That's one creative solution. But I do know the state, the governor kind of made allusions to the child care facilities that are currently compliant and currently open for emergency services personnel are not at capacity. The early estimations I'm seeing online is they're only at 30 to 33% capacity. So they may try to open up some of those already approved emergency childcare services to make them more widely available. And I believe Mayor Marty Walsh also alluded to that too. So that would be my expectation on the childcare front. On the senior care front, unfortunately, I'm not hearing as much. And I'm not surprised about that, because obviously our senior population has been by far, in a way, the highest impacted population by this event. And I don't think anyone has a good solution at this point of returning, anything other than a very small number of seniors to a singular location, or even having them go outside of their living communities where they could possibly be exposed because of the severity of the virus. And I think that it's going to be a long time before we see that population return to any kind of a normal a daily activity routine that they had before this event, because of the severity of the virus, and because we still don't have a way to protect that population adequately, and because of the severe effect that this virus is having on that population. Thank you.
All right. So as we go forward and march through phase 1, 2, and 3, and I haven't heard much about 4 as defined as post-vaccine, which will be a whole new world, really. We have one common thing, one common set of messaging through every one of these phases. And those are the 6 points that we were talking about earlier in terms of sanitation, facial coverings, and the things that you need to do. And I have a question for the lieutenant. And this isn't a curveball, but we're already seeing, and again, we have the benefit of not hindsight, but we get to look across the country and see what everybody else is doing and watch this as it travels. So now you're talking about phases 1, 2, 3, facial coverings, patience, tolerance, queuing up, being calm, being ready to embrace whatever the new open looks like. Lieutenant, what kinds of things do you want to not only share with people, but what are the things that could become a problem over time with some of these new adaptations? I'm not used to wearing a mask, and now I'm wearing it. So what are you seeing? What do you think? And what's the good message on that?
Well, I see, obviously, that you see it in the news that people are not compliant in certain areas. We haven't had much of a problem here, but going forward, we've always acted somewhat like social workers in this job. So that's not new to us. We go to these calls like a disturbance. In this case, if they're at a private business where they're not compliant, we'll try to keep the peace. And obviously, at the end of the day, if they don't want them there, they no longer desire to do business with them. So we can have them leave that property. But we just want to wear those kid mittens. We know that people, their nerves are afraid right now, and we're trying to work with that. And this is not really new for us. We dealt with this all the time when it comes to disturbances. So people just use common sense, be kind to each other. We're all going through a tough time, and realize that we're going to get through this together.
So what I'm hearing from you is that calling the non-emergency line is not a bad thing to do if you really need help. Is that right?
No, we do that all the time. We go for minor disputes all the time. And it's not just about wearing facial coverings. It's about people at a business that they don't agree on whatever return policy or whatever it is. And it's usually we go there and we talk to them, we keep the peace.
And I was going to say, we're hearing, at least in Pembroke, again, a smaller community with unbelievable people and a lot of patience. And people have been calm and they're understanding. And we really are grateful for all of that. I know that's a common theme on this panel, the gratitude for the goodwill of the people who live here. But there are people who want to almost engage, and they want to be part of a solution, right? So we're hearing a lot about, I see someone on a tennis court, or I see someone over here. What's your guidance on that? And what do you think the smart move is if you're that person? I mean, do you report it? Do you relax and let events take their course, or do you make a phone call?
Obviously, anytime people are concerned, I always suggest a call. We can we can determine whether there's a problem or not. But if you see something that you think doesn't look right, say something. In that case, call us.
Very good. Thank you. That's an important message to get out there. I think there are people who are just afraid to be a bother, and they're not sure that their concerns meet a certain criteria of worthiness. But if you guys are ready to take those calls and actually help solve that, that's a good thing for everyone to know. Thank you.
Absolutely.
All right. So, Gretchen, you guys over at the Senior Center, you've never, at least yourself, but I know you've had some limited staff, coming and rotating through the schedule so you can be available. But right now, you've had this very, unenviable job of supporting one of our most valuable communities and most vulnerable communities. And you've had to do that from a distance. And you've had to do it from behind a locked door. And it doesn't look, to Lisa's point, as though that's going to change in the early phases. So if you could just do a quick recap of some of your outreach, some of the meals programs, some of the work you do communicating with people when they just need to talk to someone at the COA, and a little bit about what you think is a valuable message to keep everyone on pace as we learn more information about what's going to be available to seniors.
Sure. Thank you. So we have kept up, as all the departments have kept up with our regular day activities amongst this COVID, whether it be fuel assistance, our daily Meals on Wheels, weekly food pantry delivery, sometimes more than once, outreach calls. There still are senior emergencies. There are emergencies for, the fire department and the police department. So that hasn't gone away just because all of our doors are so-called locked. I'm busier now than I think I was before. So we just, are on a day-to-day basis, and it really is day-to-day because it's different every day going forward and, trying to see the best way we can get our seniors back to the center. But that is unknown at this point in time when that will happen. But here at the COA, currently, we're in the process of, getting ready so we can have everything in place for my staff, one, to come back, and two, then the seniors. So we're just going to wait from directive from the state and then from PEMA and the town manager in regards to when we can safely open, because we do have the demographic that are highest at risk. So we're not bringing anyone back until it's absolutely safe to do so. And we also have done the Pembroke Hope Fund here. I think we're up to, as of today, $10,662 donated from residents from the town to give back to residents who are struggling. And if you go to the very first town webpage, I think it's like the third item down for the application. And if you go to the bulletin, it brings you right to the link to donate to that fund. So, we've already paid out for some residents, and we're, looking for more applicants and more donations, because this is not going to go away anytime soon, I don't think.
So, Gretchen, that's an excellent point. And, thank you. The Hope Fund, such a good idea. We have so many people right within our own borders impacted, and some are temporarily impacted and through the phase plans see relief coming one day, and some may be permanently impacted, and catching up on that lost 2 months or 3 months may be really the thing that makes or breaks any family. So my question to you is, applicants, all right, I know how to donate. I've donated. We all want to give. And I'm grateful that you made it so easy by changing it to the way it's formatted now. But now I'm someone who actually needs help from the Hope Fund. Yep. Can you explain the application process, how it's evaluated? What kinds of things should I be asking for? What makes sense in the scope of the fund to actually be able to deliver?
Absolutely. So you can print down the application and bring it to, I have a box in the back of the COA underneath the awning that you can leave the application in. You can leave it at Town Hall. And basically, bills that we're paying are maybe a house insurance bill, maybe a car insurance bill. There have been, some food needs, which we've been able to cover. So, everything, within reason. We unfortunately, because, there's so many people in need right now, can't pay 3 months of mortgage for you. We can, I will certainly work with your mortgage company and see if we can work out something with them. We're more than willing to do that. And we do that on a regular basis for seniors anyways, with very great outcomes. And so it's more than just the money. It's how else can we help you? So once they come here, like I had an applicant the other day, we were able to get him further services other than just paying one of his bills that he was falling behind on.
That's great. That's really great. I love that you're able to actually drill in and provide the help that's needed. Because as much as we want to give and we want to throw money at problems, sometimes you have to really look and deep dive into what's the right solution for whoever's in need. And Pembroke's always been very good at taking care of ourselves. And I'm really grateful to know you're out there doing that. Is there anything you need? Is there anything that you would ask for? I mean, before we move on to what phases, the rest of 1 and 2 look like, I want to make sure you have a chance to communicate, not only with the rest of the residents, but with your senior group.
Yeah, so especially for the senior group, I want them to be patient. I want them to be mindful still. And there's a lot of confusion about how these phases are going to roll out for us. So can you imagine how it looks to the senior population? I think a lot of people just thought everything was opening on Monday. And that was that. I don't think they realized. But I think my senior residents are very aware that it's going to be a longer time than most, but we're still communicating with them on a regular basis. And we're here. So if they need to communicate with us, to absolutely call us, because we're picking up the phone. Like I said, we have more calls, I think, nowadays than we did before. And we do plan on rolling out, once it's safe to do so, transportation to the pharmacy, the grocery store, and doctor's appointments, which the doctor's appointments we've been doing all the way around. But we're working with GATRA for that, because there are going to be new guidelines for that. And GATRA installed in our vans a plexiglass sheet so that my drivers are also safe. And we think that something will roll out in the next few weeks with regards to that. So there is hope. There is hope.
That is wonderful. Thank you. All right, Lisa, you're up again. To Gretchen's point, people did really think that everything was just going to be flung open. And I understand without and the caution and the prudence and the careful messaging is understandable. When you're dealing with something on this scope, you don't want to undo all of the sacrifices that everyone has made, from their employment to their hair, whatever it is. So the moderate and the measured approach makes sense. But now we're in phase 1, so we have people, particularly governmental offices, I'll tell you now, working on their checklists, working on their templates. Can you drill in a little bit to the specifics of what a business owner does when they open the state recommended template, and when they self-certify on their checklist, and when they start posting some of these things for their employees and the public?
Sure. So the easiest way that a business owner could do all of that, and do so very simply, the state did an actually really good job creating a template, and it's called self-certification. So every business owner should have this filled out. It should be posted within their business, and they should make sure they can comply with all the parts of it. Obviously, there's the generic, what is my business? What do I do? Names, owners, contacts, and managers. But there's also a whole guideline with checkoffs that can be done by a business very simply. The hyperlink is right on the Town of Pembroke's website, right on COVID reopening. It's I believe requirement 1, if I remember correctly off the top of my head. But
I was going to say, Lisa, can I interrupt you? Julie, would it be possible to bring that up so everyone can see
Sure.
what it is that
let's
we're
just
looking
go.
at?
Yep, absolutely. And let's just go, just so people can see, here is the the front of the website.
Perfect.
Now, if
Thank you.
click on this, which has been redone and it's fabulous, COVID-19 requirements, and you go down a tiny bit, this explains what Lisa's been talking about. And I think it's these requirements for phased reopenings that you're talking about.
Yeah.
This one is the template for business. Would you like me to bring that up?
Please, if you would.
Sure. Okay.
Lovely. So this document that we've referenced a few different times, as well as those 6 bullet points I keep touching on for businesses, this document does a beautiful job of just walking you through as a business owner. We don't expect anyone to become a COVID expert overnight, but this does a really nice job of walking through, what do you need, what do I need to have, what kind of discussions do I need to have with my employees, what are the requirements. And the reason I highlight this document is it kind of touches on everything that you need to address. Now, within this document, there's some things that you need to address that you're going to be like, oh my goodness, I don't have signage for social distancing. The town has some signage on facial coverings, which we can certainly share with business owners. But you see that signage for social distancing, there's actually a printable template right on the state website to go to and print that document. But you can just take a look at all of this, and it kind of walks you through everything you need to do as a business owner, excluding persons that are ill from your business, establish protocols so that employees can practice safe social distancing, post signage for safe social distancing. It really just walks you through. It's a 2-page, how do I open my business? And it is expected that every business that is open currently be in compliance by May 25th. And it is expected that as each other business comes online with their appropriate phase, that they too have addressed all these items. But it really is a very safe, simple, easy to read document that any business owner can walk through and become compliant. So again, it's on the state website. It's hyperlinked right here on our town website. You can fill out that document and post that on the wall and be ready to reopen as long as you've addressed those items.
All right, so now there's additional criteria from the town. And actually, Acting Chief McCormick, I'm going to ask you to help me out here. As the emergency management group digested and reviewed, and they were planning for quite a while, let me just tell you, on what could happen, multiple scenarios, lanes to the left and right. There were a couple of things that the town wanted to make sure didn't get overlooked. So an additional supplement, very short, very simple. Bullet point number 1, check, I have done my state form. Then there are a few regular, generic, and literally routine fire matters that need to be addressed, and an item for the building inspectors should any aspect of a layout changed. Now, that sounds not confusing, but I'm just a simple business owner and I'm just trying to get up and running. So would you, first of all, 2 things. Would you be able to talk to what went into sort of identifying some of those things? And as a business owner, how would I go through and know if I'm compliant or not?
Sure. So the first part of that was we sat as a team and decided that we would make every business that's going to either open now under phase 1 or in the future under the rest of the phases needs to be safe. I mean, that's our number 1 goal here is to make sure that the buildings that are open to the public are safe, and or any building open to any workers, employees. So we just came with a simple checklist that if you have a fire alarm system, if you have a sprinkler system, if you're a restaurant that has a suppression system, those need to be inspected annually. Very simple. Are they inspected? Do I have it within a year? Yep or no? Then you wanted to make sure we have keys to get in. Make sure that there's no blocked exits and all your emergency lighting and fire extinguishers are up to date. It's that simple. You just do a 5-minute walk around your building. You find some paperwork. You look, make sure your extinguishers are tagged. You check yes or no. You move on to the next one. And that's going to suffice for us in the fire department as these businesses start to open, that you did a self-certification, that you have that paperwork on hand. So when we actually get around to doing our annual business inspections, we can just kind of come in. We'll see that you have that piece of paper on the window. We can see that all of that was done. We'll take a quick review and we can kind of move on. We don't have to go through that whole process because you've kind of done it. We're here to help. If there's any questions, you can call and we'll guide you through the process. But it's pretty simple. If me, the fireman, can figure it out, I'm pretty sure the general public can figure it out. And then the building inspector one is only if you've made substantial changes to the inside and the layout. So if you've social distanced, you're fine. But if you put up barriers, walls, curtains, anything that dividers, anything that separates what the existing floor plan look like, you have to do a sketch and just submit that to the town so that we as the building and fire department know what the new interior looks like. in case we're ever in there for some type of fire issue or a building issue. And then I think the rest of it is you just go down and you make sure you're good and you sign it, you post it. It should be relatively easy, 10 minutes tops. And if you have to get some work done, you know, maybe a day to call some people to come in and make sure that you're inspected.
No, thank you very much. And I have one more for you as a follow-up.
Sure.
As we've talked to different business owners and gone through what has already been enacted by the governor, legislative order, you know, legislation, different gubernatorial orders, things that have passed, where we are with that, is the state of emergency still in effect? Do all of those hold? There's been an interest surrounding some of the more exciting, desirable, and potentially problematic businesses. So getting to a place where things like restaurants, the thing I think people miss the most beyond their regular social interactions, actually being social with food, right? That is sort of the thing that makes the world go around. I know you've worked very hard, and so has the rest of the team, but you actually took the time and met with the planning board. I understand that some of these regulations that ordinarily would get bogged down in government may be considered for a more temporary but streamlined approach. Can you talk a little bit to what that means?
Sure. So I met Monday with the planning board for many matters, but that was the first matter of business that we discussed was restaurants that opened. Does it need a site plan approval for the planning board for a change of occupancy and or change of site plan? And I gave the case that the PEMA board has been throwing around for the last 2.5 weeks, that these businesses some of these businesses, as Lisa said, don't have 2.5 weeks to wait for public hearings and things like that. So I asked if we as the PEMA board and the building inspector could then take the short line approach to that, self-certified restaurants or businesses that come up that we didn't think needed to have a public hearing for site plan approval, and authorize that and then come back to the board and let them know. And they asked that they didn't have an issue with that. They were all on board with trying to get businesses open. They just wanted to make sure that Matthew, who was their planning board secretary or administrative assistant, was on board with it and was in the loop, so he could put in his professional opinion on certain things if we miss something. And I said, I don't believe we have an issue with that. I'll bring it up at our next meeting, which is today. And I said, I think we're going to be okay with it. So what we've done is we've cut the process probably by 2 weeks, if not more, to have public hearings at the planning board. And they were on board with it. There was not one issue. They were all in favor of it.
No, that's brilliant. Thank you for that. That's a good piece of outreach, and that's something important for everyone at home to know.
Yeah.
Not only has everybody been working their regular jobs and their emergency hats and trying to be fluid with reacting to things from a distance, but we've also had to figure out a way to streamline behind the scenes the boards, committees, and commissions who are also trying to do the same thing. So
Yeah.
while doors may be locked and from the outside it looks quiet, inside it's been a lot of moving parts. And I want to thank every single one of you. It's been a real pleasure to watch, truly. As a peer or coworker, I'm just really pleased. Everybody's been amazing, above and beyond. There's going to be a meeting today at 10 o'clock for emergency management. And I do believe one of the topics of interest as the #1 rated question in the town of Pembroke currently, what about the recycling center? That facility is much in demand. We've had a lot of folks who've had just their routine grass and leaves. Plus, of course, we have a couple of people who've been home and have done some cleaning. So we have a lot of detritus that has to get disposed of in a proper and safe way. I was hoping that Lieutenant MacDonald, can you talk to how we actually went through the mechanisms of deciding that it needed to be sunsetted or closed for a brief time? I understand there was an issue, and you always want to know what that is if you want to reopen. So can you explain a little bit about what the town saw when it was open?
To your point, what happened was people were getting rid of a lot of stuff at their house, so there's more people there than normal, and it's really hard to be socially distant in that small area. And the reason for the Jersey barriers was because people were leaving things at the gate, actually blocking the gate. So for public safety reasons, they put those blocks or Jersey barriers, whatever we want to call them, to keep from people deploying stuff there on top of people going there and knowing it is closed. And they have a plan going forward just for the reopening for it to have an easy access and egress and keep that social distance.
All right, Lisa, I have a question. From the health agent's perspective, I'm going to have cars. I'm going to have a lot of cars. I'm going to have cars on the move. I'm going to have cars entering. I'm going to have cars exiting. And every one of these cars is just chock full of things that I want to take out of my car and I want to put into a bin or a basket or help me, dumpster.
Dumpster?
All right, what are the mechanics? How do you make that safe? Can you talk a little bit to that? And by the way, follow up with, I'm the guy in the car. What can I do to help make it safer?
Yep. Not a problem. I think several things are going to have to be looked at. Just as the salons and other businesses are going to have to consider that their hours may need to expand so they can spread out the customers. I think that the town is going to have to consider expanding hours at the recycling center to allow people to spread out their visits as well. By doing so, hopefully with a few extra hours, maybe adding in the Sundays back temporarily for a while to allow people to spread out more. I think that's extraordinarily important. The second part of that's going to be everyone is responsible for their own safety. We can have all the rules and guidelines in the world we want to have. But ultimately, you are most responsible for keeping yourself safe. So I'll phrase it like this, as I often do. If the health agent was going to the recycling center, what would she do? Well, the first thing I would do is make sure I have my materials all sorted in advance, organized, box contained, bagged, whatever they should be appropriately, so that as I'm going to each container, I can minimize the trips to as few as possible, go to a container, relieve myself of those items, and then go back, for my glass, my paper, my cardboard, whatever. I would try to minimize my trips. And again, I wouldn't, sort from the back of my truck while I'm standing there. That's going to lengthen my time at the recycling center. That's going to lengthen my chance for exposure. I am going to wear a facial covering if I'm at the recycling center because I know the density. When cars are parked next to each other, the opportunity to be close to other people is just there. It's unavoidable. So I'm going to wear my mask when I go up there. And I'm going to try to be thoughtful about when I go. I'm going to aim for a morning slot or a later in the day slot if that's available. And the other thing is, especially if I was someone more at risk for COVID, I would think about even waiting another week or two. Let the first, if you would, when the recycling center first opens, obviously we all know there's going to be a very high surge. If I'm a senior, if I'm someone that's immunodepressed or something like that, or someone with breathing issues, I'm going to wait. I'm going to wait another week or two if that's what I have to, so that the quote unquote first surge has gone through. But no different than when we go grocery shopping now. Now's not the time to hang out and browse. Now the time is to be efficient, get what you need and get out. Same thing with the recycling center. If you can go there prepared with all your items sorted, ready to drop and leave, that is optimal. And just a note to the residents, they've been so awesome about being so responsible everywhere they go. The recycling center is not a place to sit and, see the friend you haven't seen in 2 months and have a 20-minute catch-up session standing there for two reasons. One, you're creating more congestion by standing there and chatting. And two, you're not supposed to be there having, again, a social time that's really not appropriate at the recycling center. It's a place of business, even though it's, free residential business, it's still business. Pick up the phone, have that conversation somewhere else, but standing there having it face to face is not an opportune time.
All right, so it's safe to say that there will be restrictions regarding, or not restrictions, but there will be some kind of protocol in place to mandatory facial coverings. There will be a protocol in place for no loitering. Just move along. Some of these things will be defined, and I think that's reasonable. That would be something that would be packaged, I assume, in the reopening message along with hours and protocols. Does that even seem like it's possible? I mean, how does the emergency management group look at putting soft regulations in place regarding town space and areas we know are going to draw people?
It's absolutely possible, but again, it depends on every person doing their part. I know we've said that over and over, but I can't stress it enough. If people go to the recycling center, move about efficiently, and leave efficiently, we can absolutely open the recycling center. Unfortunately, if people go up there, hang out and talk to friends, don't wear facial coverings, kind of wander about aimlessly, we're going to have a situation where there's going to be 50 cars up there again, and we're going to have no choice but to close it. So I guess I say it's up to the residents whether or not the recycling center stays open. We are going to have a set of guidelines. I think it could open very soon. And if everyone does the right thing, I think it can absolutely stay open. And again, it's going to really depend on the behavior of the folks using the recycling center. If they follow all those guidelines, I think you can absolutely be safe, with the exception, I always give the exception, of people with underlying conditions that make them more susceptible to COVID, and the seniors. They are going to have to rethink how much time they spend in an environment like that, which is expected to have a lot of people at it.
Well, there you go. Thank you, Lisa. Thank you, everybody. I wanted to ask Julie if she's been receiving questions on the question line.
Yes, one especially, and it's a two-parter. Town meeting is scheduled for June 16th, which is less than a month away. Is it expected that the governor will increase the number of people that can gather in one place at the same time to reflect the potential amount of bodies that will show up? And also, especially since there are so many budgets being discussed as being drastically cut, and residents that want to have a say in these matters.
Well, Lisa, since it's a question about the governor, I'm going to throw that one to you.
Sure. So the problem with town meeting for Pembroke and every other community that has an open town meeting, or as I call a non-representative town meeting, we all face the same problem. And the problem is that town meeting is structured as such that every registered voter has the right to attend. And I've spoken with the moderator, and I share his concern. With the criteria, and everyone keeps talking about quorums and being able to drop quorums, I don't think that's the issue. I agree with the commenter that asked the question. There's a lot of budgetary issues that are going to be discussed that I think is going to generate an extraordinarily high turnout. So the problem is this: we do not know how many people will attend, and I share the moderator's concern that we don't have the right to turn away a registered voter to attend town meeting. That's never been done in Pembroke's history. I would assume most towns have never done something like that. So where do you potentially hold a town meeting that can accommodate 12,000 registered voters, not turning any of them away should they show up? Yes, I know usually only a few hundred people show up, but again, given the gravity of the economic situation and many other parts at play, where can you accommodate and gather safely that number of people with social distancing and everything else? I don't think you can at this time. Now the governor's going to raise the number from 10. I'm confident that's going to happen. It's even outlined in phase 2, raising the number of people that can gather. They haven't put a number on it, but it's referenced in the plan. I don't think it's going to be 12,000. So we have a problem out of the gate of, we have a governor's guideline for reopening that's going to be in direct conflict with the potential number of people that could come out for a town meeting. And you can't turn anyone away at the door. And certainly when you get to that number, you can't say, oops, we can't gather any more people, so you folks are going to get turned away. That's denying someone their civil liberties. So I think there's many problems surrounding town meeting. I've heard many creative solutions, moving them outside to sports stadiums. I mean, maybe if you had Foxborough at your disposal, you could gather 12,000 people safely. I don't think we have the capacity at any of our athletic fields unless we spread out, chairs on the grass. And then again, where do you put those? Where do you put 12,000 chairs? Or do you have people stand maybe on one of our athletic fields to have it? How do you make everyone heard? What kind of audio system? I mean, it's just very challenging, because in order to hold town meeting, you need to be heard. You need to be able to present facts. You need to be able to allow the citizens participating to comment back and be heard. And you need to accommodate that number of people that may or may not show up and at a social distancing safe method. And right now, I do not see a way to accomplish that.
And you can add to that, Lisa, not to pile on, that you now have to check them all in. You have to hand them a warrant. You don't know if you're printing 150 warrants or 12,000 warrants. So it's just a lot of moving pieces that some of the other towns, Julie, just before we toss it right back, are taking a look at things like postponing 2 weeks. I think I know some of these folks who had late May, early June, or even mid-June dates are pushing to the end of June. They're not moving their elections. I mean, all the South Shore towns just went through an election cycle on Tuesday and had remarkable success. everyone was so well behaved, and everything was sanitized, and the workers were great. It was a little different makeup of workers. We had college students instead of our regular folks that we love to see at the polls, but that there have been some adaptations that are working and some things that still need to be figured out. Did you have a follow-up? Did you have a second part
there
to
was,
that?
yeah, thank you for that, and thank you, Lisa. And that's what all the towns that we represent are going through the same process. Plymouth's a little different, where they do have a representative town meeting, and there's a specific number that they know they have to work with. The part two of this was that seniors or people over 60 often make up a good portion of the quorum. Are they going to be asked to show up even though they're told they really shouldn't go anywhere? How can they participate? And finally, who has the final say in whether or not this will go forward?
Lisa, would you
That's
like me to take it, or
yeah.
do you want to take it?
I don't know who has the final say. I can say that of course, yes, seniors make up a huge number of our quorum. I've been at town meeting now for quite a few years without exception, and no, it's not safe for our seniors to be in an environment which is going to be highly congested with people. That's more opportunity for exposure. So how do we keep that population safe and still have them participate? That's really problematic. But as far as who makes the decision, I'm sure you know that better than I do, Sabrina.
Until June 2nd, which is when the warrant would be slated to post. We must, under statute, post, nailed to the cottage door, the actual warrant of articles and business that residents can expect to be asked and called upon to deliberate and vote on. So June 2nd, June 2 is the date for that posting for a June 16 town meeting. Prior to June 2nd, the authority that's authorized to move the town meeting is the Board of Selectmen. After June 2nd, the authority is the town moderator. So there are mechanisms in place for this, but there's still, I think, information being developed. And I think a lot of these towns, particularly their executive officials who are working very hard and weighing all of these facts, are hoping, just like everybody else, that a little more time will give us a little more information. A little more information gives us a little more education and making intelligent choices. So when the board met last night, they were very aware of that. And they have asked to hear more next Wednesday night at 7 from emergency management, hoping that this next week will provide more opportunity, and it would still be prior to the warrant posting. So Julie, that's how that would work. And stay tuned for the May 27th meeting of the Pembroke Board of Selectmen.
Okay. And finally, I'm sure you may even get some guidance from the governor, and because I'm sure that task force is getting huge amounts of inquiries about, because it's town meeting time for almost every town. So this is certainly not unique to Pembroke or the towns in our area. So more to follow on that. Thank you so much, Sabrina. Those are all the questions I had for today.
Thank you very much, Julie. So as we wrap up another good week with our whole new plan, reopening, what does it look like and how do we do it safely? I wanted to just run right around one last time, say goodbye to everybody for the week. We'll be back next Thursday morning at 9 o'clock. Now that we are transitioning into a less emergent, more known and exit strategy, we're only going to be coming in once a week. That will be Thursday mornings at 9 o'clock. I wanted to take a chance to, first of all, thank Gretchen, thank Ken, thank Rick, and thank Lisa for taking the time. I know that your schedules are incredibly full, but we hear often that these kinds of quick, informative broadcasts actually get out to a segment of the population that just doesn't have the information, and knowledge is power, right? The more people know, the better decisions they make. So as we go around again, last minute to say goodbye, I want to start with Gretchen. Just throw out there what you want to hear the seniors, take in from this experience before you see them next week.
So it's going to be beautiful weather. Get outside. Do some social distancing, but enjoy the good weather. There's nothing finalized yet. We're working on plans, and we want you back here as soon as we can, but we have to be safe to do that.
Thank you, Gretchen. All right, Chief. Going into this next week, again, I know it's all systems go. Your calls are up. You're back to business. Everything's slowly moving toward a plan. What do you want everybody to know?
Just as we're moving on to get businesses open in the reopening process of our plan, just remember to go on the website, get that self checklist, make sure you get that done. Prepare so that when you actually make the call, you make the opening, that you're all set. Social distance, don't screw it up, as always, every week. And and have a good Memorial Day.
That's right. Thank you, Chief. All right, Lieutenant, as we go into next week, the folks at home are trying to figure out how they're going to get all of this done safely and with law and order, particularly Saturday at the recycling center, should the decision be made to go this Saturday. What do you have to say? What do we need to know?
The people of Pembroke have been playing ball with us, and I want them to continue to do that. Enjoy this nice weekend. Don't be a part of the problem, be a part of the solution, and happy Memorial Day.
Thank you. Thank you very much, Lieutenant. And Lisa, as always, we close with you. Going forward, the good word for the next week?
It's so easy. Wash your hands, wear your facial covering, be respectful of others. Everyone is frustrated. The success or failure of reopening businesses and different aspects of our lives that we've gone without falls squarely back on every resident of Pembroke and every resident of the Commonwealth. If people do what they need to do, we will be successful and we will move towards enjoying more of the things that we've been missing. If people are belligerent, taciturn, mean to one another, don't do the right things, we're gonna unfortunately move backwards. And I don't want that. I know the police don't want that. The fire department doesn't want that. I know Gretchen doesn't want that. So just do the right thing. Treat the people around you as if they were your friends and family. Do the right thing. Protect yourself. Protect them, and we will be able to move forward. And I for one am very much anxiously awaiting that.
Thank you very much, Lisa. And for my last words, I want to thank PACTV, and I want to thank particularly Julie Thompson, who always does an amazing job for us here in Pembroke. And they host this platform, they take the calls, they make sure that the lines are secured, they broadcast it on the channel for everyone to see, they live stream it so that it can get into the homes of people without cable. And I, for one, Julie, want to say thank you from Pembroke.
Oh, thank you. It is our pleasure, and it's not me, it's the team. There is no I in team, especially here at PACTV, and we appreciate the fact that we can do something really positive during this time. One last final thing, please, I do really suggest residents go to the Pembroke website, click on that new, the big red banner. Everything you need to know has been organized under there with all kinds of hyperlinks to different areas of information. So please do take advantage of that. As Sabrina said, we will be coming every Thursday morning at 9 o'clock to you. If you have any questions during the week that you want the panel to answer, please do email them to pembrokeinfo@pactv.org. Also, you can see all of these, and they're date stamped each time we do them, so you know that you're getting up-to-date information. But if you want to see replays, go to pactv.org/Pembroke. We will see you next Tuesday. This is Julie Thompson. Good day.